A law requiring parental consent for almost all medical treatment provided to minors has been affecting children's access to care in many ways, including the ability to call the 988 hotline. Senate Bill 1329 was passed in 2024 and requires medical providers get consent from parents or legal guardians to perform health care services, which includes, quote, the diagnosis, screening, examination, prevention, treatment, cure, care, or relief of any physical or mental health condition, illness, injury, defect, or disease. Lee Flinn, the director for the Idaho Crisis and Suicide Hotline, says Idaho consistently has one of the highest suicide rates in the United States, and the law has created new challenges in supporting minors in times of mental health crises.
I want to make it really clear that minors can still call or text 988, and we want to encourage everyone of any age to do so anytime they feel they're in crisis.
Asking for help is already difficult for people of all ages, but especially teenagers. Flynn says crisis counselors are worried that teenagers believe they can't call or text due to the law, and they have no way of knowing how many kids are struggling but not reaching out. The hotline's current practice under this law is to
listen, to understand what's going on. We will do the safety assessment so we can figure out, does their situation rise to that level of the emergency language in the law? And if it does, we proceed supporting them as we would have done before the law.
Flynn says if it does not hit that threshold, they explain the changes and then ask the minor if they are able to get permission and consent from a parent.
Sometimes, and this is the best case scenario, sometimes the minor will say, yeah, my mom's upstairs, I can get her. So we have had some conversations with the minor and a parent, and that's ideal. However, our concern is that it doesn't always work like that, and sometimes a minor will hang up on us. They'll say, I can't do that.
A bill was introduced late in the 2025 legislative session to address the unintended consequences of the current law, but it did not advance in the House. Flynn says she hopes the legislators will review and adjust the law to better support minors next year.